Welcome, welcome to the Gerontological Society of America's Emerging Scholar and Professional Organization Fall 2022 webinar entitled Tips for Transitioning to Early Career Success, Advice from Researchers in Academia, Industry, and Community Health Settings. Thank you all for joining us today. The webinar is supported by the Gerontological Society of America Innovation Fund. My name is Michelle Xue, and I am your moderator for this webinar. I am a PhD student in the Duke School of Nursing, and my research is focused on hip fracture recovery outcomes in older adults with dementia. I'm a member of the ESPO webinar task force. It's a pleasure for me to be in here today. So if you are a PhD student, a new graduate, or a postdoctoral fellow, you may wonder where your next steps are and how to leverage your passion and skills to a successful career. In this webinar, we are fortunate to have the opportunity to learn from a skilled panel of researchers who have successfully transitioned from doctoral postdoctoral programs into new roles in a variety of settings, including academia, industry, and community health. This webinar is being recorded and will be posted on GSA's website. Participants on the call will receive a link to the recording when it's available. We invite you to use the Q&A feature of the platform to submit the questions at the last part of the webinar during the Q&A session. We will try our best to address your questions. For today's agenda, we will start with introductions of our panelists. Then I will guide everyone through a list of preset questions. After that, we will take questions from you, the audience, at the end of this webinar. We are all so excited to learn from this amazing group of professionals. So welcome Dr. Esther Laury, Dr. Ashley Ritter, and Dr. Hanzhang. Thank you all for being with us today. I will first invite each of you to give a 1 to 2 minute introduction about yourself and your current position. For the audience, if you would like to know more about the panelists, you can read their full bios published in the promotional flyer. So Dr. Laury, can we start from you?
Sure. Thank you for this opportunity to speak today. So my name is Esther Laury, and I work on the policy evidence research team at Merck, the policy evidence research team is situated in the Global Market Access Organization. And on my team, I specialize in integrating social determinants of health into the research that we conduct in order to improve health equity and ensure that all patients have access to the products that Merck produces.
Perfect. Thank you so much. And Dr. Ritter, please.
Hi, thrilled to be here with everyone today. I'm Ashley Ritter. I am the Director of Clinical Care Research at NewCourtland. NewCourtland is a nonprofit in Philadelphia, Pennsylvania that provides housing, health, and social services to seniors for the most part. So we have 600 senior apartments, 2 senior centers, a nursing home, and service coordinators who are social workers in a number of settings in Philadelphia. And in my role as the Director of Clinical Care Research, I'm responsible for 3 things. The first is program evaluation for projects that we're doing at NewCourtland. The second is being the partner and sort of the point person for research studies that we do with academic institutions, other organizations, and government groups. And the third thing that I do is work to embed best practices into the work that we do at NewCourtland.
That's some really important work you're doing there. Okay, last but not least, Dr. Hanzhang.
Thank you so much for having me here. My name is Hanzhang. I'm assistant professor at Duke. I'm trained as a geriatric nurse scientist, but currently my role have a joint appointment between the School of Medicine and School of Nursing. So I'm doing research and mentoring teaching activities in both the School of Nursing and School of Medicine. So a lot of my research focuses on using existing data sources, health retirement study, Medicare claims, disease registry, and the EHR to address disparities among older adults, particularly older adults with dementia and cardiovascular disease. So yeah, thanks so much for having me here.
Thank you so much, Dr. Xu. And thank you all the panelists for sharing. I'm sure that the participants are so eager to know more about you and your experience. So let's get started on the questions. So just an overall view first, I will ask about some aspects related to your current roles, and then your future career goals. At the end, we will like to hear from you some advice for the new PhD graduates. So I will give everybody a chance to answer these questions and share your thoughts. I may also direct a question to a specific panelist if suitable, but feel free to jump in anytime you have any thoughts to share. So the first one we have in here. So the first question is, regarding your current roles, what specifically motivated you to work in this setting? So who wants to take a stab at this first? Maybe Dr. Ritter, do you want to start?
Of course. So I started at NewCourtland actually during my postdoctoral studies. And what I was looking for was what my current boss calls a dual glide path, where I was able to be engaged in the community care and the nursing practice, but I also had the ability to advance practice and continue with my research agenda. And so that was what I was looking for as I went to look for a job. NewCourtland enables me to engage with residents, staff, policymakers, researchers, and it's very tangible to the day-to-day function of care for older adults, and that really was appealing to me as I looked for a job.
Nice. Yeah. How about Dr. Xu?
Sure. So I think so my current role, because of a joint appointment, so it's kind of by nature is very interdisciplinary work. And I think I benefit a lot pretty much throughout my research career to working in an interdisciplinary team, working with clinicians, physicians, nurses, social workers, and also health service researchers, epidemiologists. So it's basically have the opportunity to tap into the resources, and especially located in the School of Medicine gave me the direct access to primary care clinics, which is a large part of my current research work. So that is really something that really drew me to think about not to take a traditional path, being just 100% faculty member in the School of Nursing, but also think about how I can piece together different resources within university can help me advance both my research and my other career goals.
Yeah, so basically just more resources for research, that's the primary motivation. Yeah. Okay, and is Dr. Laury, please?
Yeah, sure. So I when I did my postdoc at Penn, I was introduced to a variety of researchers who were doing work outside of academia. I was in the National Clinician Scholar Program, and so as a part of that program, I earned a master's in health policy research. And so in addition to the education that I received, seeing these other people in different roles outside of academia really was motivating for me to do and think about my career outside of academia. And so I did take on a faculty position for the first 3 years outside of my postdoc, but in that faculty position, I began to get really restless. I had been doing end-of-life care research for about 10 years, and so I felt like I wanted to really kind of expand and grow outside of that realm. And so I started doing small research studies that were more focused on health disparities, not just in end of life care, but among different populations, among in different therapeutic areas. And so I searched for a role that allowed me to become the researcher that I wanted to be in the future, not the researcher that I had been. And so I look for a role that allowed me to grow and become more of a disparities researcher across the board, not just at end of life.
Mm-hmm. So you found something that you are really passionate about, and at the same time, you can utilize your research skills. That's
exactly.
Yes. Okay. Is there anything that anyone wants to add for this question before we move on to the next? Okay. Okay. So the second question is kind of like two parts. So did you begin in another setting before working in your current setting? And if so, could you tell us a bit about the decision-making process around this transition?
I can start if you'd like. I was a nurse practitioner for 7 years prior to finishing my postdoctoral studies. And so I was a clinician before I went into this type of setting. And I had a very hard time letting go of those clinical encounters. It was important to me. It grounds me in my research. It had always been important to me. And so I wanted to take that into whatever setting. I was working as a nurse with a PhD and a postdoc in health policy. And so this was my first job after my doctoral training. And I am grateful for the opportunity to be able to blend those two skill sets together.
Mm-hmm. Yes, perfect. Yes. So like, do you think like this position just give you just more what do you have like originally thought, or like what do you think? So basically, are you happy about this decision, or like afterwards apparently you are, but you just want to have like the emotion part of the
Sure, I can definitely share a little bit about the emotion. So I was completing my postdoctoral studies during the pandemic. So I had a 3-year postdoc that spanned from 2018 to 2021. And it was extremely difficult to make decisions, to consider job opportunities. And so there was a lot of chaos in all aspects of my life and all aspects of everyone's life about where to sort of set your first tile as a researcher. And during that process, I was not sure that I was making the right decisions. I was making the decisions that felt right in the moment, but that moment was very charged. And so I've now been in this position for 15 months, and I'm thrilled that the decision worked out to my benefit. I'm very happy in my role. I see lots of opportunities to grow into this role and to sort of leave a framework of how community engaged research can function in other places. So I'm thrilled with the decision. It was not an easy decision to make at the time.
Yeah. Well, thank you so much for sharing that with us, because I know a lot of new graduates or postdocs, they struggle with these things, and it's very helpful to hear that we're not alone. People are struggling with us at the same time, but it will work out eventually. So thank you for sharing that story with us. And Dr. Laury, how about your experience?
Yeah, so when I came out of my postdoc, as I said, I was a professor, assistant professor at Villanova University, and the decision-making process for transitioning out of academia there were multiple factors that I was considering. So in addition to feeling like I kind of had outgrown the research skin that I was in at that point in time, I was also a young mother. My son was born in 2018 when I started as an assistant professor. And so being in academia provided me the flexibility that I needed during that time in his life and mine. But I knew that I wanted to do more. I wanted to take the skill set that I had acquired through teaching through practice at Villanova. The glorious thing about that school of nursing is that everybody does everything. And so the PhDs also had to teach clinical. The PhDs, had to have that clinical backing. And so being a professor at Villanova really turned into an opportunity for me to return to the bedside, which I didn't really have a whole lot of experience, going through my PhD. And so my nursing skill set really kind of became more holistic during my time at Villanova. And so going back to the bedside, I was a charge nurse at a long-term care facility, teaching, doing research, and then having the health policy background. All of that came together kind of beautifully. And I found a position at Merck that required all of those skill sets. And so as a scientist here at Merck, I use my background to inform other scientists who are not clinicians. I inform, people who are in the commercial sector of the company, to really think about, patient outcomes, not just the financial piece. So I think that, personal and professional elements really help to drive me to my current position and inform my decision making during that time.
Yeah, well, that's quite an experience. Like, it's very exciting to hear how multiple roles can really fit into one big picture, like for your career. And also at the same time, work-life balance is so important. Like, yeah. And Dr. Xu, how about you?
I will say that I started in a different setting than the current one I was trained at Duke, but it seems like to some extent it's, for lack of a better analogy, it feels a little bit like graduate school continue a little bit in my current role. But I can talk briefly a few years ago when I was at a crossroad to think about what I want to do. Do I want to do a postdoc? Do I want to apply for a more typical tenure track faculty member in the School of Nursing or in social gerontology, etc. So basically, a lot of the thinking I did at that point is like, what kind of environment would I want to work in, and what thing that gets me excited. And there is opportunity to actually have this joint appointment. There is a lot of excitement. People talk a lot of things that happen in the clinic. They really want researchers to come on board to help physicians, scientists to carve out some research project. But at the same time, there's a kind of a big unknown territory for me. I know the financial model that School of Medicine operates is like a soft money based, and in my department, I'm the only PhD RN sitting a department with more than 80 faculty members. So on the one hand, I'm the only fish in the desert, but on the other hand, I'm the only fish in the desert. So it's kind of like sometimes I do feel a lot of more excitement to actually wear the hat being a PhD RN in a clinical department in School of Medicine to bring nursing science to the table. They really appreciate my input. We're targeting the same problem, but like we're looking at it through different lens. So I think so far I'm 4 years in my position. I'm actually pretty happy where I am right now.
Wow, yeah, that's very exciting. But that's also very challenging to think of, like as a new graduate, like when you did all that, like, did you do that? Like, do you feel like you got a lot of support from the colleagues and to adjust to the new role? Or do you feel like you kind of figured that out on your own somehow?
I think I did get a lot of support. I think I have a really support team of collaborators around me that cross different disciplines. I think that gave me the face and it gave me a lot of encouragement to actually carve out my own path, which is somewhat a little bit unconventional. But also I feel like talking to different people and talk to senior investigators who kind of work in the space also helped me quite a bit through the transition.
Okay, thanks. Thanks for sharing. So let's move on to the next question. So question 3. So what does research look like in your setting? I guess that's a big part. Everybody cares about research. And are you primarily developing your own program of research or facilitating research of others, the institution? Anyone can jump in for that.
So I guess I can start. So one before I came to industry, I had always been told that, pharma is the dark side. Don't go to pharma because, they're money grubbing and that's all they care about. And now that I'm on this side, I can say that that is completely a myth. I can say that the research that I conduct is I have far more intellectual freedom now than I did in academia. In academia, I was on the tenure track, and so much of my research had to be focused in on one specific small area in order to get tenure. But now I conduct research that fills holes in scientific knowledge, looking at the larger scientific community. I conduct research that meets unmet needs of vulnerable populations that our products can touch. And so we make a lot of different products. And so I'm able to look across, I am therapeutic area agnostic. And so I don't have to focus on any one particular therapeutic area. I focus on the therapeutic area that is most important at this moment in time. I feel the needs of the company. And so, the company has different products that we may be coming down. We have a pipeline of products that are not available to the public yet. And so I'm able to come and look at therapeutic areas and products that will be able to touch certain groups of populations. And I can inform how we target populations, how we market to populations, how we speak to policymakers to inform guidelines. And so for the most part, I have a lot of freedom in the type of research that I conduct. I can talk about one particular study. I was introduced to the transgender population by a good friend of mine, Dana Hines, in my PhD program, and I understood the disparities that population faces on across therapeutic areas, across settings. And so I'm conducting a study right now where I'm looking at healthcare outcomes among transgender individuals in preventative care settings. And so the point of this project is to show that policies in different states are either preventative or discriminatory, or helping transgender individuals get better care, across therapeutic areas. And, Merck products touch on multiple preventative care areas. And so this is a way for me to try to increase the amount of products that can get to that vulnerable population across the country. So that's the kind of flavor of the kind of research that I conduct here. I have a lot of freedom. And the great thing is I don't have to apply for funding. Merck gives me the money to do the work.
Yes, sounds like you really enjoy seeing some tangible products of your work, and you are able to, make some impacts on the population that you care about. So that's kind of the positive the aspect of your work, is that right? Okay, yeah, sure. And next one, maybe Dr. Ritter.
Sure. So in my role, I am responsible for in really building the infrastructure for research at NewCourtland, and aligning what we're doing independently with my own program of research and what NewCourtland's program of research is with partners. And so there is some considerations that I need to be aware of. So the first is, as a community organization, the phone rings often to participate in projects. Not all organizations are good at being a responsible partner with a community organization. So my job is to make sure that we have the infrastructure in place to protect our residents and to ensure that we're able to be compensated and an equal partner in the grants that are taking place. And in order to do that, we needed to be able to accept federal funding. We needed to be able to talk about what IRB process we were going to be able to use. And we need to really establish a reputation that we are a great community partner for research, because I do want researchers and government organizations to call and say, we would like to study this problem. Would you be willing to work with us? And that needs to be a collaborative relationship. So that has been important in that I am the person that ensures that the partner is going to be responsible to our community, that the science is is done in a rigorous manner, and that we are able to incorporate that into our strategic priorities as an organization. When I'm thinking about sort of the big umbrella of research, I need to think about what are the overall priorities of research at the organization. I have expertise in geriatrics, and really my work has always centered around care coordination for people with complex medical and social. That's a pretty big umbrella. So many things fit under that. And I need to make sure that those fit into the smaller priorities of the organization. So that can be both in, where do we look in the future to what we are going to do as an organization? And the second is, do we have the infrastructure and staff and support to be able to support a research project in a particular area? And I think the example I would give here is, we have a nursing home in NewCourtland network. Everybody wants to do work in nursing homes. People will come and say, I would like to recruit for this study. And it's not necessarily that the problem isn't important or the research isn't going to be rigorously done. It's that if I say yes to all of those organizations coming and doing research with us in our nursing home, I overwhelm the nursing home staff at a time that they have really been ringer. And so you have to be really, really careful about maintaining that relationship while not saying yes to too many things that could overwhelm the day-to-day work that we do. And what I have found is that you must include all stakeholders at the organization in the work that you're doing. Research is not sort of a siloed organization at NewCourtland. We sort of spread over all the departments, and everyone knows who we are. So it's not a foreign concept when we come in and say, there's this opportunity, would you like to be a partner in that?
So you have to be super holistic of, thinking about everything and try to do all that problem solving. So that's a big part of the research process, right?
Yes.
And then Dr. Xu, please.
Yeah, I think unlike Dr. Ritter and Dr. Laury, I feel like my path is like the role that I'm currently in is pretty much very similar to anybody who is working in a large academic institutes. Basically, me as a kind of independent researcher, have the expectation to apply for NIH funding, all of that. But I think one thing for me in my role currently is because I work in the interdisciplinary space, I had actually a lot of opportunity to work with learners across different disciplines. I have medical students, I have global health students, and also have undergrad students who kind of in general a little bit interested in the space of nursing or healthcare. So it's basically there's a lot of excitement to work with a variety of different learners. So one of the example that I can share is I work with a third-year medical student. So they have a full year of doing a small research project with us. So it's kind of a labor, kind of more condensed way rather than doing a dissertation, where we actually do something quite interesting. We're looking at the acceptance of love and remarriage among older adults in the Philippines and how that's related to their quality of life and psychological well-being. This is some kind of very interesting topic that I was able to explore with my students and trainees, and potentially may not be something that will eventually become a 5-year R1 project, but I have the opportunity to work on this small but like very interesting things with different students. So that's one part I feel like I do enjoy a lot in my current role.
Oh, perfect. Thank you so much. Let's move on to the next question. And I think, yes, so for the next question, what does interdisciplinary collaboration look like in your setting, and what are your partners and stakeholders? So I think this part, maybe we can start with Dr. Xu. Since you already talked about like a lot of this interdisciplinary collaboration and work in the.
Yeah, so I think interdisciplinary collaboration, I think just because a lot of my work focuses on, we're sponsored by GSA, so like I think all of us have shared interest of promoting health and well-being among older adults, right? I think by default, gerontology, this field is kind of interdisciplinary by its nature. So At Duke, we have an aging center. We actually have the opportunity to work with social science and medical scientists all together. So my team, as I mentioned before, we have clinicians, we also have medical sociologists. So it's always fun to actually have a group meeting, talk about my project, to have get different voice and share that at the table. So yeah, I think a lot of the interdisciplinary work was actually collaborating with faculty members who are trained in different disciplines, but also in terms of partners and stakeholders, because I started to do a little bit more behavioral intervention development work in the past year and a half. So start to think about how I can engage communities, community organizations, and also to start thinking about to establish my caregiver advisory panel, so like start to do a little bit more than just collaborating with faculty or learners within our own institution. So yeah, that's pretty much the interdisciplinary collaboration that the space that I'm working on.
Yes, thank you so much. I asked because there was one Q&A in the box. So if you have anything to add, you can add on to it. But the question is, how did you find mentors and collaborators to write grants and get research going? So we want to save the questions at the end, but I think this question is specifically relevant. So if you have any thing to add to that. So the question is, how do you find mentors and collaborators to write grants and get research going?
I don't know whether we want to do the question right now, but I think it actually happened quite organically that you're working on some idea, and I know like things you're good at, and you know there are several pieces you're missing the skill set, or you're missing the content expertise, and you talk to people, and sometimes you just email saying, hey, this is a project I'm working on, and so far I haven't had anybody who turned down say I don't want to collaborate with you. This far, I think yeah, so far I've been pretty good in terms of finding collaborators within the university and also kind of within the professional organizations that where I'm belonging to.
All right, thank you so much. And thank you for the patience. Maybe Dr. Ritter can answer this question as well.
Sure. And I'll give it a few examples of what interdisciplinary collaboration looks like at NewCourtland. So the first example I'll give is about a year and a half ago, we wrote a paper at NewCourtland, a case study talking about the implementation of a COVID-19 vaccination condition of employment. So we talked about how we realized that we wanted our campus to be vaccinated, that we wanted to protect our staff as best as possible from COVID-19, and we wanted to maintain operations, decided that a condition of employment was something that was important and would help us to meet our goal. We then had to communicate that to the staff and the residents within our community. And we needed to ensure that we were able to follow up on the progress and to help people get to the point that they felt comfortable being vaccinated while losing as few employees as possible, because this was a community mission. And so we from the beginning of that process, we're documenting what we were doing and being very thoughtful about what about this process can we learn from and share with others who are in similar situations. You know, everybody was in a situation of, you know, how do I get our campus to be as protected as possible from COVID-19? So, you know, that included the HR department, that included the physicians at the organization, that included the executive leadership, that included the communication team that was comprised of community members, experts in pharmacy and nursing, and you know, people within the nursing home who had very specific questions and were really advocates and like the trusted person to communicate this information. And so that required every level of the organization to be involved. And when we published the paper, you'll see by the authorship that every level of the organization was represented on that study. It was very important that we made sure that the process was collaborative from the time we thought about that policy through the evaluation and the publication of that information. And the second thing I want to highlight is a study that we are working on, looking at applying, or really eliciting the opinions and perspectives of staff and seniors in the treatment of opioid use disorder. So again, this is something that affects policymakers, this affects people who are delivering care, this affects the staff, this affects residents, and so everybody's affected by something like this. When we are going to start this process, the first step isn't let's try an intervention. The first step is talking to our residents, our staff, and our community members. And so much of the work is really looking at qualitative methods and understanding the perspectives of people and stakeholders before we actually do anything. And so projects like that include a lot of stakeholders. They don't always have the same goals at the start of a project. And so we're very purposeful in ensuring that we bring the groups together, we talk about what is the priority, and then we move forward in a way that can be reflective of the most important goals.
Perfect. Thank you. I was amazed how you were able to put everything together super quickly. And I did read that paper and it was amazing. So I do recommend the audience to read as well. So Dr. Laury, can you share your experience with us, please?
Yes. So I have many different stakeholders, internal stakeholders, as well as external stakeholders and partners. So on my team, we are a very varied team. So I'm a nurse. We have physicians on the team. We have pharmacists. We have health economists. We have behavioral scientists. And so the point of gathering people from across disciplines to do policy evidence research is because the healthcare system is made up of many different organizations and many different disciplines, and they all come with a different perspective. And so the individuals on our team, we work together to create research studies, but we also work cross-functionally with other organizations within Merck. And so you have medical affairs, you have policy professionals, you have people who have expertise in different therapeutic areas. So people who work in vaccines, people who work in HIV, people who work in neuroscience. And so, we serve as project leads or principal investigators, but also consultants to give our perspectives on different research projects that are outside of our team. Externally, we have patient advocacy groups. We work with the government. The government is our largest customer, and so we work very intimately with the government as well as academic institutions. So vendors will do some of our studies, but as a qualitative researcher and a mixed methods researcher, there's certain research that I trust academicians to do more than a vendor. Mm-hmm. And so I reach back to my academic days, and I have friends, I have people that I know who are consummate experts in certain methodologies that I will contact to give advice and possibly collaborate with if they are the best person for the job. So interdisciplinary work, partnerships and stakeholder work is integral to my role here at Merck.
I just want to add something about timelines of stakeholders. So there's many different timelines, and people's expectations can run from I wanted this yesterday to this study will start in 2024. And so one of the most important things is understanding what the timeline is for sort of the answer somebody or solution somebody wants to a particular issue, and diversifying what you're doing as within NewCourtland at least. So we have some projects that there's a problem, we need to fix this problem in the next 4 weeks. Let's do some rapid cycle innovation with some data and outcomes to make a decision, all the way to there's a large academic grant. We're going to get our application together. It will be submitted and we might get funding in 2024 or 2025. And so we have to diversify sort of like what the portfolio looks like. And we also need to ensure that throughout that process, we're paying attention to the protection of human subjects. When do you need to go through the IRB? When is this a quality improvement? We're going to apply this to practice. What's getting published? What is really for internal use only? So it's a lot of trade-offs to make sure that we sort of are being sure that we identify the most important stakeholder and the most important timeline on any given project.
I second that.
Yeah.
That's very important timeline. You want to make sure everything lines up perfectly. Okay, so next question we have. So the next question we're going to pivot to, the future, your future goals. So do you see yourself exploring other career paths in the future and why? Anyone can start. Maybe Dr. Ritter can start, take a stab at this.
I am very happy in my role and I plan on staying here for quite some time. And what I would like to accomplish is I want to develop a successful community nonprofit research department. I want to ensure that this department lives on, after me. And I want to learn enough that I can be an expert in how to keep these nonprofit research departments going within the community. So I want to be a resource to colleagues and other organizations that are hopeful to have this type of embedded scientist role. And so that's sort of where I see myself going in the future, but I'm very happy at NewCourtland. And I'm comfortable sort of figuring out how to make this work and learning from colleagues who have done this work in other places.
Perfect, thank you. Dr. Laury, how about you?
So yeah, I have every expectation that I will, my career will morph over the next 2 to 3 years. My manager, when I was hired here at Merck, she said, we're hiring you to do a certain role today, but 2 or 3 years from now, you will be a different person, a different scientist, a different professional. In your evolution as a business scientist, you will take on different roles, and it's the expectation that you do so. So I see myself growing. I don't expect to be on the policy evidence research team 5 years from now. I have applied for different leadership acceleration programs within Merck. One of the great things about Merck is that, they will pay for you to get additional education outside of Merck, but there is a ton of professional development opportunities within Merck that professionals from across the world come in and educate us, consult with us. And so I'm not sure what organization I'll be in. It could be medical affairs. It could be on a therapeutic area, on a product line. Could be on another policy team. I don't know, but I have every expectation that I'm going to grow in responsibility, grow in leadership, and that is my goal. I would love to make Merck my career home. But within Merck, there are a lot of career paths that I can take, and I will look to do that going forward.
That's very inspiring. Dr. Xu, how about you?
As I was sharing earlier, I am happy currently in the kind of this space, and I do quite enjoy being the only fish in the desert at this point. So I'll probably continue that, and really, I don't think I'll explore other career paths in the near future. And I think I'm kind of more excited about where my current project can lead me to the next one.
Yes, that's great too. Thank you. Let's move on to the next question. So the next session will be, we are looking for your advice for new graduates or postdocs. So this question has multiple parts, so feel free to pick and choose which one you want to answer most, or if you want to answer all of them. So what advice do you have for new graduates if they want to enter into the setting you're in now? Would a postdoc be necessary, and why? What research skills are important to how to serve in your current role? Dr. Laury, maybe you want to, do you have any thoughts on that?
Sure. So for my particular role, people in this role have to have a PhD and either a postdoc focused on health policy or a master's in health policy. So for my particular role, PhD and postdoctoral training was necessary. But within Merck, there's a nursing network in Merck. There are more than 300 nurses who work for Merck, and the vast majority of them have a BSN. And so it's not necessary to have a postdoc to be to be an employee at Merck. It just depends upon what you want to do. Now, for me, I had to be a strong methodologist. I think that the diversity of my research portfolio helped me to get this job, in addition to the fact that I was also a practicing nurse. And I going to Penn, I think was great in that I had the exposure of a very interdisciplinary postdoc. I think that was really critical for me in my own thinking, as well as on paper. It looked good to have that on paper. So I think that to come into industry, it really depends upon the end point or the end goal that the person has. If you want to do research, likely you're going to need a PhD and possibly a postdoc. But if you want to do clinical research, you may not have to, or clinical work, you may not have to have a postdoc or even a PhD. It just depends.
Okay, Dr. Ritter.
I'm really loving the analogy of the only fish in the desert. And I would say that I'm also sometimes the only fish in the desert. And so a postdoc was very helpful to me. It gave me 3 more years of methodological experience, project development and management skills, and relationships with other academic professionals. And so I'm very grateful for my postdoctoral training. The other is that my postdoctoral training included health policy training and leadership training, which is essential in sort of the delegation of tasks and aligning people's priorities when you conduct a research project. And so I'm very grateful for that. And in a role where you might be the only researcher, I think that postdoctoral training in the right setting gives you skills that are essential to be successful. I would say that not all positions are like that, but when you are potentially the only fish in the desert, the more experience you have, the better that might serve you moving forward.
Thank you. And Dr. Xu.
So I didn't go through a postdoc experience. It's just at that point, the opportunity and other things come in play for the decision not going for a postdoc. But because I was at that point, I knew kind of postdoc might not be something that will happen down the road. So at that point, I was thinking a bit more proactive. With additional training I will need to be able to survive in academia. So I think during my last year of my PhD, I actually signed up for a program called the Prepare for Future Faculty Fellowship. That is a thing offered at Duke, basically give an opportunity to shadow a tenure track faculty member in a different school, just to know like the life, what are the expectations, what are the struggle in terms of being a woman and being an international scholar in a U.S. higher education setting. I think that was like really helpful for me, not to think about just how I can do my research, how I want to do teaching, but also the environment, the culture, and how to kind of get your mindset ready for that kind of transition from a PhD student into a faculty. And another thing, I feel very fortunate in my current role that although I didn't have a postdoc training, but our vice chair for research has been very supportive of me to think creatively what additional career, kind of training that helped me to advance my career that might be helpful that we can talk about. And I was able to build that into my career development work. I get additional training in terms of developing intervention, which is something I didn't receive tons of formal training through my PhD, so able to kind of piggyback on career development work despite I don't have a postdoc to really help me to build additional research skills to advance my projects. So yeah, that was my experience, that I didn't go through a postdoc, but I was able to find creative way to kind of be able to help me to leverage to build additional skill sets.
Yes, thank you. So that's possible. That's good to know. So we only have like a couple minutes left before we go to the Q&A section. So if you guys want to just briefly talk about this question, that would be helpful for our audience. So is there something that you know now that you wish you would have known earlier in your career path? Maybe, yeah, Dr. Ritter.
I just want the stress. What I wish I knew is that it would all work out, but the stress involved in the job search, and I think some of the pressure that can be put on you by yourself, by family, by mentors, is real. And so I wish I knew that it would all work out. And the things that helped me to be successful were not a skill set or a relationship. It was just trusting myself in what I wanted as a person and where I wanted to go with my career, and what I'm good at and what I'm not good at or maybe don't like. Like, be true to yourself, and the process should work out. And so I wish I knew then that if I just trusted myself and my reflection, that it would be okay, because that was a really stressful transition.
Thank you. Dr. Laury?
I think I wish I had known that there were opportunities outside of academia earlier than when I learned them. I didn't really learn them and believe that I could take advantage of the opportunities until my postdoc. You know, as a pre-doc, it was the expectation that, you know, you would go into a faculty role. And so we didn't really get a lot of exposure to people who were not in academia. So I think that had I known that there were paths outside of academia earlier, my decision making might have been different. But to Ashley's point, I'm grateful that, you know, I meandered slightly, just because, you know, those additional exposures helped me to be who I am today. And so I'm grateful that I was able to learn what I enjoy, learn what I don't like, learn what I'm good at and what I'm not good at. And I truly do believe that your gifts will make room for you. And you know, if you are true to who you are, and you follow your own heart, you'll end up where you're supposed to be.
Perfect. Dr. Xu?
So I think graduate school, people will tell you, you need to have publications, you need to learn how to do quantitative or mixed method research, and you need to think about how you can write grants. That's basically the basics, and also teaching part, that's the basic skill set you need to survive as a tenure track faculty member in academia. But no one actually told me, and I wish people have told me when I, like maybe a couple of years ago when I was still a student, that you actually are going to be a businessman. So basically you need to know how to pitch the idea to different founders, and also need to know how to run a research team with different research staff, students, and collaborators. So sometimes I feel I'm kind of doing all the things by myself. As a PI, you need to make sure you get the budget right. You need to know how you can talk to the financial team and how to engage stakeholders. So it's basically running your own business. That's your research project. But like, those are the things that people didn't tell me when I was graduate student. Wish I've learned all the other aspect, just kind of besides just doing the research part a few years ago.
Right. So thank you. And I just want to thank you for all the panelists for sharing your thoughts on these questions and your helpful advice. I have learned a ton, and I'm sure the participants on the call today will feel the same way. So really appreciate your insights. So we'll just like give the audience a couple minutes to ask some questions to you. And I'm gonna take the slides down so that everybody can see you. So we have one question from the audience, specifically for panelists working outside of academia. So either Dr. Ritter or Dr. Laury can answer this. So how did you get to where you are? Did you network with people at Merck? In other words, did you know someone at your current position to be hired? And how's your typical work day look like? Maybe Dr. Laury can start on that.
Yeah, sure. So I did not So I did network. I networked with a person who was in my pre-doc. I was on Facebook one day and I just asked a random question about feeling. I think I was like, I feel irrelevant in my current role. Has anybody done anything outside of academia? And one of my friends from my pre-doc, she was working at Eli Lilly. And so I reached out to her and I was like, what does your everyday look like? Are you happy? What kind of research are you conducting? Because I'm curious. And so she talked to me over the course of a couple of weeks. She told me about her everyday. She told me about how she was able to get through the interviewing process. She gave me some coaching and tips on how to answer pharma related interview questions. And I took the information that she gave me and I applied it to the job description that was online for Merck. And so one of my mentors in my PhD program, she would always say, how do you eat an elephant? One bite at a time. And she would always also say, how do you skin a cat? There's 1,000 ways to skin a cat. And so I took the job description on the Merck website and I broke it into little bitty pieces. And I looked over the course of my experience as a nurse, as a researcher, as a teacher, and I started picking out different pieces of my career experience that met the job description. And so over the course of 2 or 3 days, I had created an 18-page document that literally translated my research, clinical, teaching expertise into what this job description was asking for. And it became clear to me that I could do the job. And so I networked with people from my past. My neighbor around the corner worked at Merck. And I asked him, do you know anybody on the research side of the company for me to get a referral? He's like, I don't, but I'll send a note to the hiring manager on your behalf. And he did, and she answered. And so, I had to go through the rigors of the interview process. It was 9 interviews. It was a lot. But in the end, they told me I was the top candidate and I got the job. And so it wasn't just interviewing with people from my professional network. I interviewed or talking to people from my professional network. I talked to people from my personal network as well. Play every card that you have. That's my advice.
Thank you, Dr. Laury. And because of the time, maybe we can take another question. I know there are so many good questions, but we cannot solve them all that today, but certainly feel free to reach out to the panelists if you wish. So that another question we have in here is, what do you like least about your current position or wish could be different? So maybe Dr. Ritter, you have any thoughts on this?
I think the hardest part of my job is you can't do everything and do everything well. So you have to be careful that you don't say yes to too many things. At the end of the day, you want to ensure that you finish what you start and that you pay attention to the things that are most important. So for example, I am responsible for some patient care in my role, and that was a request of mine. It is something that remains important to me. And I am a better researcher because I see patients once a week. And so when there's patient care issues that happen from time to time, that takes my time, and that must be attended to first. When that happens, it's unpredictable. And I have to put other things to the side. And so I have to be very good about delegation and communication and not saying yes to too many things, because I am committed to finishing what I start and being focused. And so I would say that's the hardest part of my job.
Thank you so much. And I think, we had such a rich conversation today, and I certainly want to keep this conversation going forever, but we want to be respectful of your time and the panelists' time. So, but really thank you everyone for participation. And before we go today, it's just like another thing. We want to just give a big applaud for all the panelists, and thanks for their time and willingness to share. We are able to, to have this much insight about where we might go after graduation, how to get into the next steps. So really thank you everyone for your participation today. And then like just a couple thoughts before we are done. So thank you for the audience for joining us today as well. The recording of this webinar will be posted on the GSA website and a YouTube link. And if you're, so we would like to hear your feedback very much to better serve you in the future and to give you more helpful information for your career development. So if you have a moment, please fill out the survey afterwards. The link will be sent to you through an email and also a link to the webinar as well. So thank you so much for joining us today, and please have a great weekend.
Thank you.